This is CNN Breaking News.
Breast cancer is the second most commonly diagnosed cancer worldwide, including low and middle income countries. In the United States, breast cancer accounts for over 260,000 cases each year and is responsible for over 40,000 deaths. Some individuals inherit defects in the DNA and genes like the BRCA1, BRCA2, and P53, among others. Those with a family history of ovarian or breast cancer are at an increased risk of developing breast cancer.
Good afternoon. What brings you in today?
Hi, I was just coming in because I had some pain on my right breast and I just wanted to get it checked out.
Okay, we can get you seen today. I'm the certified nursing assistant and I'm going to be part of your care today, okay?
Okay, great. Thank you.
No problem. So I'll begin with taking your vital signs. I'll just be using this here and this to take your blood pressure, your pulse, your oxygen level, your respiratory rate, and your temperature, okay?
Okay.
Okay, can I get your first and last name, please?
Yes, my name is Sarah, last name Flores.
Okay, thank you, Ms. Flores, and your date of birth, please.
Yes, it's going to be 5/22/1974.
Okay, thank you. And so I took your vitals. Everything is within normal range. Do you have any questions for me before we take you to your nurse here?
No, thank you.
Okay. All right, Ms. Flores. Did you want to bring anyone in with you today?
Yes, I did. I wanted to bring my partner in with me, my wife.
Okay. Okay, perfect. So she can come in with us. And I'm sorry, what's your name?
My name is Jocelyn.
Okay, thank you, Ms. Jocelyn. All right, guys. So here we have your nurse. Her name is Lucero, and she'll be taking it from here and following up with your assessment, okay?
Okay, thank you.
Hello, Mrs. Flores. How are you?
I could be better.
And who is this with you today?
This is my partner.
Okay. How are you guys?
We've been better, as my wife said.
I'm glad. Okay, I'm going to go ahead and ask you guys a few questions, if you don't mind. Will you like your partner to be with you, Ms. Flores, or is it okay if she stays with us?
Yes, I would like her to be present.
Okay, perfect. So what brings you here today?
So on my right breast, I started to notice that I had some slight lumps, and I just wanted to get them checked because my mother did have cancer, breast cancer, and she was diagnosed about 65 years old. So I just want to, just check, make sure.
And when did you notice this?
I would say I noticed it about, I don't know, a couple of weeks ago.
Okay.
I was in the shower and, as I was cleaning, I felt it. Not a big deal. I didn't think it was that important.
Okay. And do you have any allergies, Mrs. Flores?
No, I don't. I don't have any allergies.
Okay. And do you have any chronic illnesses?
No, nothing like that.
And how many pregnancies have you had?
None at all.
Okay.
Yeah.
And when was your last mammogram?
I've never had one. I never felt that I needed to have one.
Okay. And do you usually do a self breast examination? Do you check yourself for any breast or any lumps?
No, I don't think there's really a need to.
Okay. And when was your last period?
It was, I would say, I don't know, a couple years now.
Okay. And as far as medications, are you taking any medications?
Currently, no, I'm not.
Okay. And as far as the family history, you said only your mom has had breast cancer before?
Yes, that's correct.
Okay. Now that I documented your history, I'm going to go ahead and begin the physical assessment. I'm going to ask you to please lay down so that we could go ahead and check your breast area.
Okay.
The reason why we want you to be laying down is so that your breast tissue could spread out evenly, so it can make it easier for me to feel the lumps and all the breast tissue. If you are going to feel some discomfort, and if the discomfort becomes too painful, please let me know and I'll go ahead and stop and go slower. You're going to feel pressure. I'm going to go ahead and apply some pressure around your nipple area and your breast and your axillary area as well. Please let me know at any moment. I'll go ahead and stop if you feel any pain.
Okay.
Okay. Now I'm done with the physical assessment. Everything good? Are you feeling any pain right now?
Just some slight tenderness was felt, but
From a scale 1 to 10, what would you rate that pain?
I would say it was about an 8.
An 8. And it's usually when you felt pressure, or does it just stay there?
I would say it stays there.
Okay.
And you know,
Okay, sounds good. I'm gonna go ahead and note this, and I'm gonna discuss my findings with the doctor. Do you guys have any questions for me?
no, I'm okay. Thank you.
Okay.
I think that's all for now. Thank you.
Hello, Dr. Smith.
Hi, Lucero. How are you doing?
Good, good. I'm here to discuss the findings on patient Flores.
Okay.
So I went ahead and did a physical exam on her, and the findings for her. She's a 46-year-old female. All her vital signs were within normal limits. I did, as far as the breast exam, there was some hard nodules present in the right breast. The masses are present in the upper outer quadrant, and more masses were present in the underarm area. The masses are non-movable, tender, and have irregular borders. The patient does have a history of a positive first-degree family member, which is her mom, for breast cancer. The mother actually passed away due to the breast cancer. Patient noticed the nodules about a few weeks ago, and she noticed the enlargement and tenderness recently.
Okay, thank you, Lucero. You had mentioned that she has not had a mammogram, correct?
No, she does not.
Okay. Well, she is, based on your report, she is at risk for developing breast cancer. You said her vitals were within normal limits, so that is good. Thank you for the report. I'm gonna go ahead and step in with the patient now so I can get some more information and let her know what's gonna be the route that we're gonna take.
Thank you,
Okay.
Dr. Smith.
So good afternoon. My name is Dr. Smith. Who do I have the pleasure of meeting today?
Hi, my name is Sarah Flores, and this is my wife.
Okay. Hello, Mrs. Flores. So I received the report from Lucero, and based on the assessments, you are at risk to developing breast cancer. Lucero let me know about the lumps you were feeling, the pain, the discomfort. Right now, based on the assessment, we can't rule out cancer or any other diseases, but what we're gonna go ahead and go with is a mammogram, if that's okay with you. Basically, what that's gonna be is it's gonna be an X-ray of your breast, and in that way, we can assess whether you have masses or anything going on in there. Okay, is that okay with you?
Yes, that's fine.
Okay, so I'm gonna go ahead and write your referral so you can get that mammogram done, and we'll see you after we get some results. Okay.
Okay, thank you.
Welcome back, Mrs. Flores and Mrs. Flores. How are you guys doing?
Yeah, okay.
Okay, you still have pain in the breast area?
Yes, I do.
Okay. So I did receive your results, and it appears that in the mammogram there are some tumors and cysts, some shapes that appear to be that. From this point on, since we do see that in the mammogram, I'm gonna go ahead and the next step is send you over for a biopsy. What that's gonna be is we're gonna take a little bit of the tissue where the masses are at, and then that way we can rule out whether it's benign, meaning that it's just it's not cancerous basically, and malignant means it is cancerous. So after that biopsy, we'll get a better picture. But I am gonna send you off to my good friend Mia Valdez. Dr. Mia Valdez. She's an oncologist, so she can further help you. Okay. Right now, I'm gonna go ahead and let you go with our case manager so she can answer any more questions. For now, do you have any more questions for me?
No, I don't.
Okay.
Thank you.
So for now, let's not worry. Let's wait for the results, and then we'll take it from there. Okay.
Hi, Ms. Flores. My name is Clarissa. I'm going to be the case manager working on with you. I understand that your results came back concerning for breast cancer, and you have a referral for Dr. Mia Valdez. So I'm going to go ahead and set up that appointment, and I'll go ahead and hand you all the paperwork once you leave here, so you can go ahead and see her. And I'll just be working behind the scenes, coordinating all your appointments, and I'll, working with you through your treatment. Okay?
Okay, thank you. I appreciate it.
Do you have any questions for me?
No, I think I'm okay. I appreciate it. Thank you.
Hi, Mrs. and Mrs. Flores. I have your test results here. Your biopsy and your mammogram are showing that you do have stage 2 breast cancer. It is in your entire right breast, and it's spreading down to your right underarm as well.
I knew it.
Does this mean she's going to die?
No, we caught in stage 2, so I do think she has a very good chance of fighting this off. It's still really early, and she has plenty of options still at this point. So what I would
Okay,
recommend is if she were to start with radiation, and then we go in for a mastectomy, and then end with radiation as well.
You can just take it all. That's fine. I don't need them. If you need to take them all, that's fine.
no, it's not fine. It matters to me. So I'm wondering after the mastectomy, what can we do to fix the issue?
For my medical opinion, I would recommend removing both breasts, as there is a chance that it could return in the other breast. So just to be safe, we can remove both breasts, and you do have options for breast reconstructive surgery afterwards, if you are interested in that.
Okay, that's good to know. Then go ahead and do what's best for her at the moment.
Yes, that's fine. You can remove both breasts.
Okay, so for right now, with your radiation treatment, I am going to be leaving you with a prescription for Vicodin and Zofran. This is for nausea and pain during your radiation treatment. So you can go to the pharmacy and you can pick that up on the way out.
Okay, thank you. My name is Sarah, and I'm here to pick up my prescription for Zofran and Vicodin.
Okay, hi Sarah. Can I just get your first and last name and your date of birth, please?
Yes, my name is Sarah, last name Flores, and my date of birth is 5/22/1974.
Okay, perfect. Yes, I do see the prescription for Vicodin and for Zofran. Have you taken these medications before?
No, I have not.
Okay, so for the Vicodin, this is a pain medication, and some of the side effects that you can that you might experience are confusion, dizziness, sedation, which is like sleepy. You might feel drowsy and fall asleep. You might feel euphoric feelings, hallucinations. You may get low blood pressure, and it may cause constipation. So it is important to take this medication as prescribed per the doctor. When you're on this medication, make sure to avoid driving or any activities requiring alertness until you know how you react to this medication. And you also may get dry mouth. So sugarless gum or hard candy may help with that as well. And for the Zofran,
Yes, I think that's for my radiation therapy.
okay, yeah. So this is it's supposed to help you not feel any nausea when you're doing the therapy. So make sure to take this medication 30 minutes before your treatment, so that way it could work throughout your treatment. This one may cause headaches, diarrhea. It may cause constipation as well. So with this one as well, take as directed and make sure to notify your provider immediately if you notice any symptoms of irregular heartbeat or any involuntary movements of the eyes, the face, or your arms or legs, okay?
Okay, thank you.
Do you have any more questions about the medications?
No, I'm okay. Thank you. I appreciate your help.
Okay, have a good day. Thank you.
Thank you.
Hi, welcome back, Mrs. and Mrs. Flores. I just wanted to tell you after this last round of radiation that you are now cancer-free, so congratulations. I do remember, and I have here in my notes, that you were possibly interested in breast reconstructive surgery. Are you still interested in that?
Yes, that's fine. Yes, we have to listen to the boss, so yes, that's fine.
Okay, so I'll send you over to a consult with Dr. Will now, okay?
Okay, thank you.
Hi, ladies. My name's Dushel. First off, I want to say congratulations on a successful cancer treatment. And I guess you're here because you want to talk over your options with breast reconstruction. Basically, the breast reconstruction involves an implant or a flap of skin from another part of the body to reconstruct the shape of the breast. In your case, you had a total double mastectomy, so I would just recommend going with the implants. But a lot of post-cancer patients aren't interested in going straight back into surgery, so we also have options like prosthetics and things like that. And keep in mind the surgery, you're not going to have sensation in your breast anymore. You're going to start to feel back. So it's more just body image and self-esteem. But if that's something you're interested in, we can move forward with that as well.
Okay, yes, I know my wife didn't want to have the prosthetics, so yes, we'll go ahead and do the surgery, the reconstruction.
Alrighty, sounds good.